Welcome back. Thank you for staying with us. The General Secretary of the Civil Service Association has broken his silence on the performance of the former CSA President turned Health Minister, Mary Isaac. Claude Paul says he's bitterly disappointed with Isaac's dismal performance and questions her relevance as a member of the government of St. Lucia.
One member of the Civil Service Association has given his opinion on the performance of former CSA President turned Government Minister Mary Isaac, and is not too positive. Claude Paul, who is the CSA's General Secretary, said he is unable to hide his feelings about his former colleague's inactivity in her current position anymore. Paul said the person who once stood bravely and defiantly against the government for the sake of the people which she served is simply no more.
Here is someone who was a former president of the CSA and at the time a strong advocate for workers' rights and for, general welfare of workers. And at this point in time, to have workers subjected to the kind of conditions that they have to endure at St. Jude's, at Victoria, and in the other health facilities as we have seen, is really an indictment of her. I mean, she has not said anything. She's been very quiet. From someone who was a champion of workers to now be very quiet and saying nothing either way is really disappointing. And the vast majority of public officers who would have supported her at the time are seeing her in a completely different light today.
Paul went on by further questioning Isaac's relevance in government and whether she is deserving of her salary.
You hear different people speaking on healthcare, and the statements she makes from time to time, are hardly worth listening to. And so, I don't know. I really don't know that the money that's being spent to pay her, is it worth it? I'm not sure about that. I think we need really to take stock of ourselves, because here's a country that is scarce in resources, and then we are wasting money, in my view. Because who is really the Minister of Health? Can we answer that question? Do you know who is the Minister of Health? Where is she? It came out in the Calypso, Where is Mary Isaac? We're not hearing her.
Paul's statement was made following a press conference where he sat alongside members of the Trade Union Federation on Tuesday morning. Reporting for Hot 7 News, I am Rochelle Gonzalez.
The president of the Nurses Association says nurses have provided care for patients under the most trying of circumstances and have been largely silent. The association is now calling on the government to not take the commitment of nurses for granted and to hear their cry for better and safer working conditions.
The president of the Nurses Association, Alicia Baptiste, is bringing into sharp focus the plight of nurses across the island. She says they have suffered in silence for far too long, but no more. Baptiste says the myriad of issues that nurses have to grapple with on a daily basis do not only impact the nursing profession, but also the entire country, given the impact on public health.
No longer can we remain these nightingales, whilst the environment in which we work are deplorable. Our staffing are inadequate, and yet we are expected to do the impossible with less. We have labored hard whilst families celebrate birthdays, Christmas, and other holidays. We are at work taking care of our patients and clients. May we add, yes, we chose this humble profession, and we are and continue to be committed, but should not be taken for granted. We, the people of this country, deserve better, and so we call on our leaders to hear our cry.
The working conditions of not just nurses but all hospital staff has been on the front burner following the collapse of the ceiling of the maternity ward of the Victoria Hospital on Saturday. The acting executive director of the hospital has informed that no one was injured and that the adjacent room with only one patient was evacuated as a precaution. The aging infrastructure and the torrential rains, she said, made for a perfect storm, so to speak. The Nursing Association's president says the matter underscores the need to relocate.
For us as an association, when I saw that, of course, I became very concerned. That means if this came down If rains continue, more will come down. And I think we have reached a point. Our nurses are at risk and the people, and it means it could be any one of us. And I think the time has come to move to the new hospital. It is time. We have waited enough. And these are just signs that we need to move.
Baptiste is calling on the government to do what is necessary to ensure that the move to the Owen King EU Hospital can happen in quick time.
The Police Welfare Association says that a meeting with the government negotiating team this week will open the door for discussions of many issues affecting the police force. President of the Police Welfare Association, Travis Chico, spoke with Solange Alfred.
A new position by the government negotiating team has stated that the Police Welfare Association must meet with the general membership to receive its mandate. The Police Welfare Association president, Travis Chico, is looking forward to meeting with the general membership to iron out the mandate, and Chico is also insisting that the nature of the job warrants discussions on salary increases, amongst other things.
You could just imagine how long we've been under wage freeze in this country. We've been working through some of the worst conditions as police officers. Our hours of work are indeed long. We work in excess of 72 hours and 96 hours as police officers, and we are called on duty during times of hurricane storms and you name it. But the Police Welfare Association, after 8 years, going into 9 years, believe that it is very fitting at this point in time to discuss salary increase, to discuss conditions of work. We believe that it is very important that we rally around our members in fighting the battle of negotiations on their behalf as it speaks to certain things that we believe which is very necessary at this point.
Chico expounded that the increase in crime on the island must be taken into account with regards to the Compensation Act. Under the existing regulations, surviving family members receive an amount equal to 3 years' gross salary at the date of death and other entitlements as provided under the National Insurance Corporation Act and the Fire Service Act.
We believe now that the Compensation Act, which covers the police during the loss of life on duty, is greatly inadequate. And we believe now, with the agreement that the employer has agreed to provide the necessary insurance, this was a negotiating period that we felt that we would have put our paper on the table and to go around securing the best deal as it would cover our members in excess of $500,000 to $1 million.
Chico expressed that the welfare's principles remain aligned with peaceful and amicable resolutions, and if the decision were to go a different route from what they are hoping for, the Police Welfare Association will remain astute in working towards better working conditions and gaining entitled benefits for its members. Reporting for Hot 7 News, I am Solange Alfred.
Faces of Cancer is working hard to sensitize people about various cancers, prevention and proper treatment. The organization's president says there are many popular myths surrounding cancer and one extremely dangerous one which surrounds diet and nutrition for cancer patients.
A diagnosis of cancer is a terrifying thing for most people, but Faces of Cancer is endeavoring every day to make it easier for those who have to wage the battle against cancer. There are many myths and unsubstantiated miracle cures that people buy into their quest to beat the disease. President of Faces of Cancer, Dorothy Phillip, says even with the issue of healthy eating and healthy lifestyles, some cancer patients take it too far to their detriment. She says it is imperative to debunk the many myths surrounding cancer.
Yes, we need to eat healthy, but we also need to eat everything in moderation before and during treatment. And this is something we're trying to bring home to people, because a lot of times we see cancer patients going for treatment and they are malnourished only because they have cut off key foods out of their diet. And this does not work well when you are going to go to such a rigorous treatment as chemotherapy.
According to the island's Ministry of Health, cancer alone accounted for 20% of all of the deaths in St. Lucia in both 2015 and 2014. Fortunately, Faces of Cancer has been able to make inroads on a grassroots level to spread the message about cancers.
Last month we were very busy. We had a packed month ahead of us where we did 4 health fairs in 4 different communities, which were very, very well attended. We saw over 100 people in each community we went to. We did offer free mammograms and free ultrasounds in an offer to lessen the burden of cancer on communities and St. Lucians on the whole.
Philip says with the merriment of the Christmas season quickly approaching, it is essential that people are armed with the correct information to make good food choices and to ensure their overall good health.
This is the Hot 7 Nightly News. Stay with us. We have more news coming up after the break.